So I'm here with Tyson. Tyson is with me all the way from Melbourne, Australia. And today we're going to talk about what happened to Tyson when he got rhabdomyolysis. So Tyson, my first question to you is, how did you get rhabdo?
Yeah, so my history was a little bit different. I had some early episodes where I really didn't know what was going on, and I remember around 2008 having some examples where I'd been running a fair bit, and I was getting what I thought were muscle cramps, but just really bad muscle cramps, and in my calves. And I'd been running a fair bit. I was training for my first marathon back in 2008, and you go from running long distances, wearing the metrics, so I don't know, 80 or 90 kilometers a week, maybe 50 miles or thereabouts a week, so reasonable load. And one day you wake up and you can't walk. I was often finding that it would happen right at the start of a run. So, the first time I remember feeling the pain, I was actually away with work at a meeting, and we were playing just a social basketball match. And, I was probably the fit guy on the team, and they wanted me running up and down the court. And there was a point where I just had to go and sit down on the side, and I said to my workmates, I can't walk anymore. I just had this immense pain, and I just put it down to cramps. I really didn't know what it was, and had a couple of days rest, and then didn't know about it for a few more months until it came back a second time.
So this sounds like it was almost a cumulative thing where you may have gotten it training for your marathon, and then you're going out to play basketball, and it may have been maybe the running plus the basketball kind of made that perfect storm.
Yeah, that's absolutely, my experience has been, it's always been cumulative for me. I've been fortunate that I can almost do anything in a day, when I'm conditioned. I'm able to go for very long, bike rides and runs and work out. And if I have my rest, and that's what you learn over time, that I am able to take a fair bit of load. And one of the things that has confused doctors over time is, a lot of people with these underlying conditions can't do a whole lot. They go for a few mile run, and they're falling over on the side of the road, where I'm able to train 5 or 6 days a week, sometimes pretty long, fairly intense sessions, and then it will just come over time after several weeks. And I don't always know it in the session I'm doing. It's often a couple of days later, and you put the runners on and out you go, and you just can't move.
And you were never diagnosed with any underlying metabolic genetic issue, were you?
No, so back in 2014, where I had the worst case, I'd woken up in the middle of the night. I'd had a virus, and I just went to have a wee, and I actually passed out over the toilet. So my wife called an ambulance, and when the ambulance arrived, I was coming in and out of consciousness. So, it was a difficult time. I had my eldest son, and we've now got 3 boys, but my eldest was 3, and he saw me lying on the floor. The paramedics hooked me up to the ECG, and my heart had actually paused for 8 seconds. So, my wife had said, we thought we were losing you that night. So they took me to the ED, and there were a whole lot of tests that took place after that. One of them that they wanted to rule out was my heart. So a cardiologist, checked me over. They had the kidney specialist check me over. And one of the things that I'd never made a link linked to was when I was 4 years of age, I actually had a deformed ureter and I had to undergo surgery. But the outcome of that was I've only got one working kidney. So yeah, they did a number of tests, and what I think what the outcome was, the one kidney, along with what was more than likely an underlying muscle disorder, meant that when I was putting my muscles through stress, my kidneys weren't working as hard as they needed to. So the kidney that's there is big and strong, but it's just not enough to take that level of load. And the neurologist that I saw after this was fantastic. And I remember him ringing me one day and he said, Tyson, I've got good news and I've got bad news. We've got all your results back. I'd had a muscle biopsy. I'd had the fist pump test. I'd had all the bloods. And he said, I can't find anything. And he said, but you and I both know there's something there, because, this keeps happening to you, but it's not something we can diagnose. So it was hard news to take.
You're not kidding. Did they did they actually make a diagnosis eventually of rhabdo?
Yeah, absolutely. So they diagnosed rhabdo, and they've diagnosed that on multiple occasions. What they didn't diagnose was what the underlying disorder actually was. And and I know often it's untrained athletes. You hear the story, right? You go into the gym and you do a whole bunch of squats and you get rhabdo. But I was well trained, and it was a little bit different to some of the typical cases that you hear about.
And I'm glad you brought that up, because that was going to be my next thing I was going to point out to people. A lot of people assume it's beginners that get rhabdo. You're a fit guy training for a marathon and you got it. That's a message I think needs to get out to people. Rhabdo takes no prisoners. You can be fit or unfit and it can still pop up. Were you doing any dietary supplements at the same time that this occurred? Do you remember any protein shakes or any kind of supplements?
I wasn't doing a great deal. I mean, I'd have I was drinking my electrolytes and all that sort of stuff. I was having a multivitamin, and I used to take fish oil as well. So and it was interesting. I saw a sports doctor after this too, and he was one of the doctors with one of the AFL football clubs over here, and specialised in athletes. And he said to me, stop taking all the vitamins and stuff. You're just making your kidneys work a little bit harder. So yeah, no, take very few supplements. The only thing that I have now is some amino acids. I find that they help a little bit, but yeah, there's nothing that I've taken that will stop it. It's really managing the load for me.
Yeah, exactly. So your big symptom with rhabdo was pain, I'm guessing. Were there any other symptoms? Well, except your heart stopping as well. That's another bad thing that I think maybe people had missed. Your heart did stop beating for a little bit. So as I often say, rhabdo is as serious as a heart attack. But were there any other symptoms besides that? Any dark colored urine? Like you said, you were going to the bathroom when you passed out. Did you have the dark colored urine?
Never. I never had the dark colored urine, and that's obviously a sign that people tell you to look out for, and it was always the one that I never had. I always had clear urine.
Yeah.
But certainly the pain, and I've heard other people and they talk about the pain. Yeah, for me the pain is hard to describe, and even now I do find it difficult to describe. But when I've had it from running, it's typically in my calves, and you can't move. Walking's really not an option. When I've had it more, I've moved between running and triathlon as well. And when I've had it that I think is more induced from cycling, and it's in the quads, and the quads are very big muscles. So when you get pain in the quads, it's unlike anything you could experience. And it really just feels like you've been stabbed in the quads. So, if you can imagine someone with half a dozen knives and they're just jamming them and twisting them in the muscles. and interestingly, I'm on a Facebook group here, and there was another cyclist, and I just said, hey, what have others experienced? And the guy said as well, it feels like you've been stabbed. So yeah, it's not a nice pain, that's for sure.
I have a friend who described it, and I actually use her description these days. She said it felt like her muscles were being put through a meat grinder and her bones were breaking. And that's pretty much how I describe it to people now, because I, again, never had it myself. When she said that, I'm like, wow. I mean, I knew it was bad, but that's a very, very descriptive thing. But stabbing pain, it's never, that's a very descriptive pain, description of the pain as well. Did the pain hurt when you were not moving, or did you have pain all the time?
It hurts when you're not moving as well. So yeah, it's not like DOMS where you sort of try and walk downstairs and it hurts, but yeah, it's definitely pain that is just there,
Right.
and it's relentless. Yeah.
Mm. Did they give you any painkillers in the hospital, and did they work?
I don't remember actually them giving me any painkillers. I think it was certainly, you're on the IV for a few days. So I think I spent 3 or 4 days on the occasions that I was in there.
Yeah.
And they may have given me some painkillers, but
Yeah.
it hurts for a while.
Right. How long were you in the hospital?
Look, it was 3 or 4 days on a couple of occasions. It's very much a case of you're on the IV, you've got people trying to figure out what's going on. And the thing that was difficult early on is most doctors don't actually understand this. And certainly I had a good GP, and he was trying to understand it, but you get into an ED, and they've got to get the right person for you, and they've got a lot of questions to ask. And I think the second time that I went in, I knew a lot more about it than they did. So when I went in, I said, you need to check my CK levels. I'm suffering from rhabdo. I've had this before. And they're like, how do you know that you've got it? And I'm like, can you trust me? you need to get me on a drip very quickly.
Wow. Do you know what your creatine kinase, your CK levels were?
Yeah, typically between about 15 and 20,000. Yeah. So that was, and that was where the pain was just excruciating, and I've had a lot of examples where my CK levels have been 2,000 or 3,000. And so, and my understanding is there's no clear definition of when rhabdo actually kicks in. So, but I have found that when they're around that level, I feel it coming now. And that's been one of the benefits for me. And, you said, what were the other symptoms? Mm-hmm. For me now, I get very tired if I've been training hard. In the past, I would have thought that fatigue is just, hey, you're training, press on. Now that needs to be a cue for me if I'm tired. And I can also get a little bit vague. You can lose 10 or 20% of your cognitive function. So it might just take you a little bit longer to answer a question, and you don't feel right. And my wife knows it as well. She's like, are you okay? And I'm like, I think I need a couple of days rest. And typically I've gone and been tested, and my CK might be 2,000 or 3,000. So I'm at a point now where I could just about walk into a doctor and say, I reckon my CK are this, and it wouldn't be too far off the mark.
I wonder if the fuzziness you feel sometimes is maybe due to the fact you're having one kidney, and maybe it's not processing metabolites as well as two kidneys were. Again, I'm speculating right now as you're talking. So, but that's, take that for what it is, just pure spitballing it. One of the questions people ask me is when they get rhabdo, most common question is, when can I go back to working out? And how do I go back to working out? How long did it take you after you got out of the hospital to resume your normal activities?
Yeah, I guess there's the quality and then there's the time, because when I had the worst ones, coming out of the ED, CK levels at 20,000, my muscles were physically, they'd shrunk. Like I got out of the hospital, and you're looking at your muscles and you're thinking, they used to look pretty good, and they looked like they had just shrunk and they weren't athletes' legs anymore. So once my CK levels were down, sort of under 500, I would wait a week or so and then head out for a very easy run. Like I might do a 5K run, so just a few miles. But you don't feel the same, and that's the thing that surprised me. I remember the first time, I went for a run, and it was a lot slower than I would have normally run. My heart rate was higher, and it was just harder, and what I was finding as well was I was having examples where I'd start pulling carbs, so in the couple of months afterwards, because you've lost all this muscle mass. So to think that you can just go and do what you used to do, it really takes a good 6 months to get back to somewhere near the level you were at before.
Wow. Yeah. As I said to people many times, time and patience are your friends when it comes to recovering from this. Not everybody snaps back in a week or 2 weeks. Matter of fact, most people don't snap back in a week or 2 weeks. And as you rightly said, it could take multiple months before you feel like your old self again. I'm curious, when you were discharged from the hospital, did the doctors give you any advice on what to do when you went back home?
They did, yeah. And a lot of doctors just tell you to stop being silly and don't exercise so much anymore, and I think athletes with rhabdo need to understand what they're going through, because I had a lot of doctors tell me that the lifestyle choices I was making were not the right ones, and that's really hard to take. Are you a professional athlete? And no, I'm not a professional athlete, but it's important to me. It's a way of life for me. So, 90% of the doctors tell you to pull your head in and stop exercising. It makes you really question what you're doing. But I
Mm.
did have a couple of doctors who said to me, take your time when you get back. But there was one in particular who was actually a cardiologist, and he was a cyclist as well. And he'd gone in and he looked at my, what had happened with my heart. And I said to him, everyone's telling me I need to change my lifestyle. What do you think? And he said, the biggest risk is not doing anything. The biggest risk is not being fit and not looking after yourself and not eating well. So the risks of doing nothing are greater than what you're doing. But hey, you don't want rhabdo again. So, listen to your body
Yeah.
and take it easy. So yeah, it's an emotional time as well, because you got to deal with all of these data sources telling you different things, and you've got to try and make a decision on what's best for yourself.
Yeah, I agree. You mentioned it's an emotional time when you go through rhabdo. Did you suffer any? I don't want to say. I sometimes call it a post-traumatic stress disorder like syndrome. But after you had rhabdo for the very first time and you're getting hit with all this information, oh, you can't work out again, and you know, how does that affect you mentally when you hear about all this? Because I want to like to get out to people that rhabdo is kind of a systemic issue. It's just not physical, but I think there's an emotional component to it that I don't hear anybody talking about, but I hear the same thing over and over from people, that there is an emotional aspect, there's a stress aspect. Can you speak on what you went through when this happened to you?
Yeah, I mean, what I would say is that the times that I had the bad attacks, I was at my peak, and I was training for an event. I was extremely fit. I had some ambitious goals. So, as a marathon runner, one of the things that I was trying to do, ironically, on both occasions, was I wanted to break a 3-hour marathon, and I was getting very, very close. And I'd recently run a good half, and I was right on track of where I needed to be, and I just put in a little bit more, so I was convinced that I was my lifetime fitness, and then a few days later, you're lying in a hospital bed, and you've got doctors telling you that you probably shouldn't run anymore, that you're making the wrong lifestyle choices, and then you realize that some of your goals may not be achieved, and for me, I was seeing other people that I competed with. They were all going on and they were continuing to progress, but for me, I knew that I had this limiter, and if I hit it, it was going to set me back substantially. So I needed to make some decisions that I still wanted to be a runner. I still wanted to compete, but the sort of aspirations and goals that I had needed to adjust, because my body wasn't going to take the load and the work that was required to do that. And it does take a while to adjust to that, because you might be seeing other people you're competing with and you're like, I can beat that guy, but it wasn't going to be the case. So if you're not an athlete, you probably don't understand. But if you are and you're competitive, then it's part of who you are. And if you can't do those things, it hurts, and I still have times now where I get out and I'm training well, whether it's on the bike or I'm running, and you start to say to yourself, I can do more. I can compete again. I can get to that level. But you've got to give yourself a reality check and say, my body's probably not going to do that.
Yeah. Is your wife a runner as well?
She is. Yeah. She's a runner, and she's my number one supporter. She's been with me through every episode. She reads through my notes and my medical history, and she wants to understand it. She's always wanted to know what's going on and to help me with this. So she's fully supportive. She's always backed me. She's never wanted me to stop doing what I love. I've got three young boys, or we have three young boys. They're active, they play sport, and I want to be a good role model for my kids. So yeah, there's no plans on stopping anytime soon.
Outstanding. Do you have any advice? Last question. Do you have any advice for anybody who's watching us right now who has rhabdo and is trying to understand this better, or what to do with themselves if they're, going through this right now? Do you have any words of encouragement or advice for them?
Yeah, look, you need to listen to your body, and you need to be patient. And the thing that I say about rhabdo is, you may not understand a lot about it, but with what you've been through, you'll already understand so much more than other people, and possibly the doctors as well. So I think that you need to absolutely listen to your body, and that's what I've learned. If I get tired, something's going on, don't let it happen. So, and I see lots of questions on social media from people who've had it, especially for the first time, and they're really not sure. The other thing I'd say is, and I've only learnt this recently, that there are some great, Facebook groups and things. And if you can get on there and ask questions and know that other people have actually been through it, and I've never met anyone face to face that's experienced what I've experienced. I've never, and I've spoken to running coaches, I've spoken to personal trainers, and I'm like, have you ever met anyone that's got this? And, so you can feel very isolated, and, and I think use the crowd to your advantage, and someone else will have experienced it. And be part of that community, and listen to your body and give yourself time.
That's great advice. So is there a way people could reach out to you if they wanted to? You have a website or anything?
I don't have a website or anything, but I'm on Facebook. So yeah, people can look me up, and I'm happy if anyone wants to ask any questions.
Excellent. I'll link to your Facebook page in the description of the video and the podcast. So very cool. Tyson, I appreciate you taking time out of your day. I know it's early morning. You're going to go for a run right now. But I know you're definitely going to help people a lot with your words, because again, there's not a lot of people willing to talk about this, what they went through to help others. So I'm infinitely grateful for your time, and I know other people are as well. So thank you very much.
Thanks, Joe. Nice to talk.
And you as well.
See ya.
That was good. Excellent. You did great.
Thank you.
Yeah, it was terrific. Oh, man.
Yes.